Hello everyone, welcome to Body Gist. In this edition, we want to look at an important topic, a topic that borders on our newborns and infants. We want to look at the baby's soft spot. It is also called fontanelles. Why are we talking about babies' fontanelles? This is because I've seen a few women looking worried when they bring their babies to the clinic, complaining that their babies are sick or dehydrated or emaciated, attributing this sickness to this baby's soft spot. So in this video, we shall be dispelling the myths surrounding baby's soft spot. In Nigeria, in the western part of Nigeria, the Yorubas call this soft spot Okaori, while the Igbos refer to this soft spot as Nkuwaisi or Ntiwaisi. The Hausas call it Pasuanke. If you are new on our channel, I am Sister Ozo Augusta, a sister of Sembi. I am a nurse and a midwife. Do well to click on the subscribe button so that you do not get missed out anytime we upload new videos. You can as well follow us on all our other platforms. We're on Twitter, Instagram, and Facebook. Ensure you watch this video to the end, so do not go away. We'll be right back. Welcome back. Baby's soft spots or fontanelles are potential spaces within the baby's skull where sutures of the baby's bone are yet to fuse together, leaving a potential space. These soft spots, they are two in number. They are located anteriorly and posteriorly. And these bones or the sutures of the skull does not fuse together until the baby has attained certain age. For the anterior fontanelle, it fuses and closes up when the baby has attained from 18 months to 24 months of birth. And the posterior fontanelle closes earlier than that. It can close as early as 6 weeks or 2 months after a baby is born. The anterior fontanelle is a bit bigger than the posterior fontanelle. It is kite or diamond shape, while the posterior fontanelle is triangular in shape. And these fontanelles, like I said before, they are potential spaces. Blood vessels pass through these potential spaces. That is why you notice pulsation on the baby's head. This is due to the fact that blood vessels run through it. And these potential spaces, they don't have, there is no bone covering these potential spaces, like I said before. So it is just the layer of the skin overlaying the membranes on the skull. That is why you will notice the pulsations on these soft spots or fontanelles. The fontanelles or baby's soft spots, they are anatomical structures. They are present at birth. They are present in every child at birth, except in few abnormal cases where you have a child born without this soft spot. What is their function or their importance? First, it aids during delivery of the child. As this baby is delivered through the vagina, as the baby passes through the birth canal, it allows for some form of molding in the head and overlapping, allowing the head to pass swiftly and transverse through the birth canal, preventing the pressure within the cranium to occur in the skull, and it also prevents damage to the brain, which is inside the skull. Secondly, during development of a child, it is believed that within the first few years of birth, the brain of the baby develops rapidly. This potential space gives room for this development and prevents damage to the brain. This potential space, which will later close up when the baby has attained 1 year, 6 months, that is at 18 months or even 24 months, up to 24 months after the birth of this child. So these are the importance of this soft spot or the potential spaces that allows for development of the child and allows for baby to be born, most especially children who are born, who are delivered through the birth canal. It allows for molding and prevents damage to the brain and the structures within the brain. We have said that these soft spots are potential spaces. They are there, present at birth. But when do we begin to notice these soft spots? Though some mothers notice the soft spot in their children who have few or scanty hair on their skull, you will know, because the hair of the baby is not covering that space, so you will notice it. Then in some cultures, for example, in the Yoruba culture, where a child's hair is shaved within the first 7-8 days of birth because of the tradition and because of the naming ceremony. This soft spot will become prominent because, of course, there is no longer hair on the baby, so you notice the pulsation. Then, at other times, when it is pathological, baby is severely malnourished or severely dehydrated or is having severe infection or the baby is severely sick. Of course, with malnutrition or a baby that is malnourished or severely dehydrated, there's dryness of the skin and there's lack of skin turgor. You will notice the head prominent and this soft spot will become more prominent. And it is at this spot people begin to advise women, most especially in this part of the country in Nigeria, begin to advise them not to take the baby to the clinic because they believe that this is not what you can treat medically except through traditional means. Parents and caregivers, they heed to the advice of people around them, saying that this possession of this soft spot or the prominence of this soft spot is not something that can be cured in the hospital. So they seek traditional means to get a cure for their child. First, they give children local herbs and concussion. Local herbs and concussion that does not have dosage and that they are not able to, that is not estimated. This can cause damage to the baby's liver and to the baby's kidney because this liver and kidney are just developing. Secondly, at the spot where they notice this position, especially on the anterior fontanelle, they apply local herbs and concussions on it. Remember, I said that these soft spots are potential spaces. They are only covered by a layer of skin. There are no skulls or bones around the place. So these local herbs get absorbed directly into the brain and can cause damage and brain retardation for the baby. It can also erode the skin on the layer of this on that part where these local herbs are applied because some of them are actually corrosive. They can cause damage to the baby's brain. These applications of these local herbs are very dangerous for a child at that particular point in time and for a baby of that age. So the baby's soft spot or fontanelle, if you notice it prominent or bulging, you have to rule out the fact that the baby's hair has not just been shaved or the baby does not have a scanty hair. These are physiological means or the natural processes that occur. Then you also have to rule out the fact that the baby is not sick at that particular point in time. So take your baby to the clinic, take your baby to the facility. Let us check if the baby is dehydrated, if the baby is having sepsis or infection or the baby is malnourished. We will treat what is wrong with the baby. We will treat the baby's sickness and not the fontanelle because the fontanelle or soft spot, they are natural processes that babies are born with. Like you refer to it as Pasuanke in Hausa, Okaori in Yoruba, and Nkuwaisi or Ntiwaisi in Igbo. Whatever name you give it, just know that they are anatomical structures and potential spaces that is present for the baby at birth. It is present on the skull of the baby at birth and it will later close up. Application of local herbs or giving of local concussions to children cause damage to them rather than being beneficial to them. These spaces, like I said before, they are normal and present at birth. If your baby is sick, please visit a baby-friendly clinic and get your baby to get the adequate and right treatment. I hope you have benefited from this video. If you have, please do give us a thumbs up and do not forget to like our video, share our video with your loved ones. Drop in the comment section if you are a Nigerian. Let us know what baby soft spots or anterior or fontanelles are called in your local language. If you are not a Nigerian, you can also tell us what you call it in your own culture. We'll be glad to get to know it. This is me saying thank you for watching this video, and to all our returning subscribers, I say a very big thank you. Keep following us on Body Gist while we keep giving you healthy gist. I remain Sister Ozo Augusta, a sister of St. Louis. Thank you.